Welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. Well, 2025 is certainly going to be the year and the age of AI. I can tell you that everything is changing so much in the era of ChatGPT. And what we're going to do today is we're going to trial a podcast that actually has been really formed by AI, Google formed AI. And it's a conversation between two individuals that really were fed data about myself and the history of becoming a plastic surgeon and an expert in plastic surgery and that pathway. So I want you to listen and to give me your feedback on what do you think of this as a podcast. And I'm just going to start with a brief intro on what it takes to become an expert in plastic surgery, and then we'll listen to the podcast, and then I want you to give me your feedback on what you think of it as a educational and informative tool for you. So what makes you a plastic surgeon? What makes you excellent? You know, there's a lot of things that make you excellent, but there's really three main things that make you great. It's, you know, to become the best, you have to have great role models. You have to train with the best, and you have to then embrace change and keep learning. And of course, you must fail before you succeed and get better. You have to do those things if you're truly going to become an expert. And really, in plastic surgery, it's one of my greatest mentors was Jack Gunter, who formed the Dallas Rhinoplasty meeting. He was my mentor, and then eventually I helped to mentor him throughout his latter part of his career, because that's really the sign of an incredible mentor. And now I'm doing that with all of the people that I have trained, and that's so fulfilling. And really, it's about the vision. You know, the Elon Musks, the Steve Jobs of the world. It's really about what are these key traits of excellence that we see in these people? You know, it's amazing when you analyze them. And there are really 5 things that do that. It's their vision, their focus, their ability to persevere, and to always remain positive, and to do hard work. Hard work permeates everything. I can tell you that. And then that's really grit. And John Wayne had true grit. And true grit is that sustained effort and enthusiasm to obtain a long-term result no matter what happens. You know, give it your all, redo it, ignore giving up, and then take the time to do it right. That's grit. That's true grit. And I can tell you, that's the one predictor of success for all innovators. It's a combination of passion and perseverance for a long-term goal, because failure always will be there, and it's a stepping stone to success. So that passion, that positivity, and perseverance is the same in plastic surgery, because that pathway is very, very long, and it can be challenging. And whether you're going to be doing plastic surgery, writing books, all these things are very, very important. The most important thing is to stay consistent in whatever you want to do, and become very focused in getting great results in rhinoplasty or facelifts, whatever you like to do. But that consistency really allows you to permeate through all of the things that you're going to go through, that ups and downs of being an expert. So, and that means you're going to fail. You're going to fail before you succeed and get better. And failure breeds long-term success if you have true grit. So, you know, you can look at Steve Jobs. They fired him from Apple when he went on vacation, and he returned and transformed it into one of the most amazing companies with products like the iPhone and so much more. And Abraham Lincoln, he's one of my role models. He lost 8 of his 10 life elections, and he became one of the most amazing presidents in United States history, and really saved the Union, and he preserved it. And then, but mastering whatever you want to do is a painful process. It requires experience, expertise, and exceptional results. And that there's no short road to that. You can ask Elon Musk, and that's Steve Jobs talked about it all the time. It's really, really important. And you have to develop that. You're not born with it. You have to develop that. So the key adage is never, ever, ever give up, as the famous Winston Churchill said so many times during World War II. So that's the most important thing. So with these as an intro, let's dive into this AI generated discussion on the pathway that Google used in making this an interesting podcast. So take a listen.
All right, everyone, get ready for this.
Oh, yeah.
We're diving deep into the world of Dr. Rohrich.
Huge name in plastic surgery.
Yeah, an icon, really.
For sure.
We've got a ton of his articles and some really insightful YouTube interviews.
A lot to unpack.
So much to unpack.
I'm excited.
Beaking out already.
Yeah.
Let's start with Rohrich's roots.
Okay.
I was so struck by his story, in that interview with Dr. Lohr,
Yeah.
growing up in a small German-Russian farming community in North Dakota.
Wow.
Didn't speak English until he was 6.
Seriously.
Imagine that dedication to learning.
I know.
It's incredible.
Speaks to his values, too.
Oh, absolutely.
Hard work, honesty, purpose.
Right.
You can just see how that upbringing shaped him.
Yeah, his work ethic, patient-centered approach, all of it.
And that close bond with his brothers, family, is clearly so important to him.
Definitely a strong foundation there.
Yeah.
Now let's talk about his career.
Okay.
Starts at Baylor College of Medicine, initially drawn to cardiac surgery.
Intense.
Right.
Yeah.
But then he sees a cleft lip repair,
Oh, wow.
and it completely changes his focus.
Like a light bulb moment.
Total light bulb.
He talks about it as being transformative, realizing he could combine surgical skill with artistry. It's not just fixing a physical problem.
It's deeper than that.
Way deeper.
It's about restoring well-being.
Psychological well-being, confidence,
Exactly.
the whole picture.
He sees the person, not just the nose.
Exactly.
And that holistic approach really comes through in his specializations.
Oh, yeah, for sure.
Craniofacial and pediatric surgery at Oxford,
High stakes stuff.
and then hand and microsurgery at Harvard.
Wow.
Such a diverse skill set.
You see it reflected in his work today?
Absolutely. Okay, let's talk about mentorship.
Okay. A huge theme for him.
It is, right?
He really believes in surrounding yourself with the best.
Learning from the best.
Always learning.
I love that quote from the interview. He said,
Yeah.
"You never want to be the smartest guy in the room.
So good.
It's all about evolving,
Being open to new ideas.
challenging yourself."
Absolutely.
And he walks the walk.
For sure, he names his mentors.
Yeah. Dr. Spiro, Dingman, Groblin, May, Gunter,
Giants in the field.
and their legacy is alive in his work.
But also in the surgeons he's mentored.
Over 350 plastic surgeons trained under him.
Wow.
More than 10 of them now lead departments across the U.S.
That's incredible.
Talk about advancing the field.
Speaking of which, Dallas Rhinoplasty,
Oh, yeah.
the training program he co-leads,
Internationally renowned.
founded by his own mentor.
Dr. Jack Gunter, over 40 years ago.
Think about how many surgeons they've trained.
It's mind-blowing.
Over 177,000 worldwide.
Wow, that's a legacy.
It's not just about numbers, though.
I
It's
know.
the approach.
Yeah.
Precision structural rhinoplasty, preservation rhinoplasty, minimally invasive rhinoplasty,
So many techniques.
all core to their curriculum.
And it attracts surgeons from everywhere,
All corners of the globe.
bringing their unique perspectives.
Learning from each other.
A true melting pot of knowledge.
It's really fascinating.
Okay, we've talked about pushing boundaries, refining techniques,
Yeah,
but it's 2024. We can't ignore social media.
definitely not.
He had a really interesting chat with Dr. Ashkan Ghavami about this.
Oh, yeah, I saw that.
It gets into the ethics of it all.
Yeah.
Rohrich is all about using social media for education,
Transparency,
showcasing work,
honestly.
managing patient expectations.
But there's that shadow banning issue.
Yeah, Ghavami brought that up.
It's wild. Patients can post about their procedures.
But surgeons get penalized for showing the same content.
Crazy, right?
Such a tricky landscape.
It really is.
They both stress doing your homework.
Board certification.
Authentic before and after photos.
Trusting your gut.
So important.
Don't skip those steps.
Absolutely not.
All right, let's shift gears to patient safety.
Okay.
Rohrich's article with Dr. Savetsky and Avasha.
Must read.
It's all about prioritizing well-being, upholding the Hippocratic Oath.
It's more than just aesthetics.
It's about the whole person.
And it's about constantly evolving.
Think about the progress.
Yeah.
Mortality rates for things like liposuction.
Brazilian butt lifts.
They've plummeted.
That's huge.
Thanks to better training and technology.
But Rohrich doesn't stop there.
No, he outlines those 8 key steps for safety.
So important.
They're applicable to so many fields, honestly.
Yeah, like honest communication.
Huge.
Patients need to know the risks and benefits.
Absolutely.
Thorough pre-op assessments, avoiding overly complex procedures.
Yeah, those marathon surgeries.
It's about choosing the right approach.
For sure.
He also stresses accredited facilities.
Board-certified anesthesiologists?
It's a team effort,
It's the key.
providing the highest standard of care.
From start to finish.
It's not just about the scalpel.
It's about building trust,
Prioritizing safety.
empowering patients.
I love that.
Yeah.
All right, are you ready to dig into Rohrich's research?
I'm ready. Let's do it.
This is where it gets really interesting.
Oh, yeah. Welcome back.
We're back.
More Rohrich.
More Rohrich.
His insights on rhinoplasty are
Yeah.
so interesting.
I know that article with Dr. Erasdan.
Yeah.
They're all about building a solid foundation.
It's like a house. You
Exactly.
gotta have a strong framework.
Before you even think about the pretty stuff.
Right. Address those functional issues first.
Like what?
Deviated septum, problems with the turbinates,
Turbinates. Those are...
inside the nose, help with airflow.
Oh, right. Okay, so it's not just reshaping. It's about breathing, too.
Exactly.
Function and form.
They talk a lot about the septum.
Yeah, the wall of cartilage.
Divides the nasal cavity.
Right. What's their take on that?
Rohrich loves this technique.
Oh, yeah.
Submucoperitoneal dissection.
That's a mouthful.
It is, but basically it's about preserving as much cartilage as possible.
He's all about that cartilage.
It's precious.
Yeah, the building block for a strong nose.
Exactly. And they also talk about septal extension grafts,
Okay.
especially in cases where the septum is weak or damaged.
Right. From previous surgeries, maybe?
Could be. Those grafts help project the tip.
So important for support.
Yeah, and for aesthetics.
It's all connected.
Absolutely. Then they get into this technique called component dorsum.
Okay. This sounds complicated.
It is, but fascinating.
So what's the gist?
It's about preserving those upper lateral cartilages.
While still refining the dorsal lines.
It's a balancing act.
Rohrich is a master of those nuances.
He gets it. The intricacies of nasal anatomy.
Knows how to work with the tissues so delicately.
They talk about using spreader grafts, flaps,
All to reconstruct the dorsum.
and create those smooth lines everyone wants.
Right. And when it comes to tip refinement,
Sutures?
sutures, really.
It's amazing shaping and contouring with just sutures.
So precise.
Like an art form.
Rohrich talks about transdomal and interdomal sutures.
Yeah, to adjust projection, rotation, definition.
He even uses a 4-point tip suturing technique.
I know, I can't even imagine.
Requires such steady hands.
Definitely. And for patients with thicker skin.
Where tip definition can be tricky.
They often use tip grafts.
Oh, right, to enhance projection.
Refine the shape, provide more support.
Okay, that makes sense. Now, what about the alar rims?
The edges that frame the nostrils.
Right, what about them?
Rohrich is all about preserving and supporting them.
Of course he is.
He often uses alar contour grafts,
To prevent.
notching or retraction.
He thinks of everything.
He really does. Such attention to detail.
That's why he's a leader in rhinoplasty.
Blends artistry, technical skill, deep anatomical understanding.
Absolutely. Okay, let's switch gears.
Okay, what's next?
Fillers in rhinoplasty.
Liquid rhinoplasty.
Sounds less scary than surgery.
Definitely.
Less invasive, good for subtle refinements.
Or for patients who aren't ready for surgery.
But safety is still key, right?
Always. Rohrich, Dr. Agrawal, and Dr. Savetsky.
Okay.
They have this article about safe filler techniques.
Oh, yeah. What do they say?
Deep midline injections, avoiding high pressure.
Important. Those blood vessels in the nose are delicate,
Exactly. Rohrich approaches it with the same care.
as you would with surgery.
Absolutely. He even mentions using Botox sometimes.
Interesting. What for?
Drooping tip, bunny lines, things like that.
So it's a combined approach.
Often he looks at how the nose moves, too.
During expressions.
He wants to make sure it looks good at rest and in motion.
Now, what about ethnic rhinoplasty?
Oh, he talks about that in one of his YouTube videos.
I saw that.
It requires a different kind of sensitivity,
Because of those unique features.
of different ethnicities.
Right. And Rohrich is all about preserving heritage.
Enhancing, not erasing.
Exactly. He wants to create harmony,
With the patient's overall face.
not just transform them into something they're not.
Exactly. I remember his conversation with Dr. Gavami.
Yeah, they talked about thicker skin.
Lower nasal bridge, those kinds of considerations.
It's about finding that balance.
Between refinement and preserving identity.
Right. They also touched on social media again.
Yeah, the shadow banning thing.
It's frustrating. Surgeons trying to educate,
Showcasing their work ethically.
and the algorithms penalize them.
It's tough. Rohrich and Gavami really emphasize research.
Board certification.
Authentic photos.
Trusting your gut.
It's so important.
Absolutely. Okay, back to those fresh frozen rib grafts.
I love that conversation with Lisa Miller.
Me too, from MTF.
Yeah, it's on YouTube. You should check it out.
I did. Rohrich's emphasis on graft quality.
It's incredible.
98% of potential donors rejected.
I know, they're so strict.
They're really committed to safety,
Absolutely, and those grafts are so valuable.
especially for revision rhinoplasty.
Yeah.
That extra
The
support.
customization options.
Rohrich uses them for everything,
Augmenting the bridge.
refining the hips.
Supporting the alar rims.
They're like a Swiss Army knife for rhinoplasty.
Okay, I've been wanting to talk about preservation rhinoplasty.
Yeah, it's getting a lot of attention.
Rohrich has that whole YouTube video on it.
He breaks it down really well.
It's all about preserving the natural structure as much as possible.
It's different from the traditional approach,
More aggressive reshaping with that one.
but Rohrich is cautious about the hype.
I like that. He's level-headed,
He wants what's best for the patient.
not just chasing trends.
And he says preservation rhinoplasty isn't for everyone.
Right, it depends on the anatomy.
The desired outcome.
He believes in tailoring the approach.
And remember his component dorsum technique,
Oh, yeah, that's a great example.
blending elements of both approaches,
He's so innovative.
but always with that critical eye.
Safety first.
It's inspiring,
He's not afraid to embrace new techniques.
but he's thoughtful about it.
And patient well-being is always top of mind.
That's the mark of a true master.
It really is.
It's amazing how much we've covered.
I know, from North Dakota to rhinoplasty.
Patient safety, non-surgical techniques.
He's done it all.
And he's not done yet.
There's more to come.
He keeps inspiring
Pushing boundaries, always staying grounded.
in those core values.
Ethics, safety, patient care.
It's an incredible legacy. We're back.
Final part.
I'm so intrigued by this side of Rohrich.
Oh, yeah.
Leadership, giving back.
It's inspiring.
It goes beyond just the technical stuff.
Absolutely.
Before we wrap up,
Okay.
there's one more piece of the puzzle.
What's that?
Cultural sensitivity.
Oh, yeah.
Patient-centered care.
Especially with ethnic rhinoplasty.
Exactly. I'm thinking of that article.
With Dr. Baris Shuker,
Yeah. Middle Eastern rhinoplasty.
they really get into the nuances
The challenges.
of working with this specific population.
And they emphasize sensitivity right away.
Understanding those aesthetic ideals.
Within the culture, it's so important.
Rohrich is all about preserving ethnicity,
Enhancing, not erasing,
individualized beauty.
not cookie-cutter results.
Okay, so what about the anatomy?
Middle Eastern noses often have
Yeah.
thicker skin,
Okay.
lower nasal bridge, wider base.
So the surgical approach has to be adapted
Of course, to
Yeah.
address those features.
while still creating harmony.
Rohrich and Schicker talk about their techniques.
Yeah, structural support is key.
They use cartilage grafts a lot.
For the bridge, tip projection.
Those building blocks again.
Essential, they also talk about refining the PIP,
Narrowing the nostrils.
addressing asymmetry,
It's so comprehensive.
art, and precision.
Plus, that deep understanding of the patient.
Exactly. But Rohrich goes even further.
Oh, yeah.
He talks about the ethics.
The philosophy of treating diverse patients.
It's not just about technique.
It's about empathy, respect,
He stresses open communication,
really listening to the patient,
understanding their goals,
their cultural values,
building that trust.
making sure they feel heard.
It's so crucial.
It goes beyond just rhinoplasty, honestly.
Any healthcare provider could learn from this.
Absolutely. Okay, let's talk about Rohrich's leadership.
He's been so active in organizations.
President of the American Society of Plastic Surgeons.
The Rhinoplasty Society?
He's a builder.
He's founded so many things.
Dallas Rhinoplasty Symposium.
The Global Aesthetic Alliance.
Bringing surgeons together.
From all over the world.
Collaboration, education.
Advancing the field.
For everyone.
Raising the bar.
And then there's his philanthropy.
Operation Smile.
Face the Future Foundation.
Helping children in need.
It's amazing.
Transformative work.
Okay, as we wrap up this deep dive,
Yeah.
I keep thinking about what we can learn.
From Rohrich's journey.
We've seen his mastery,
Dedication to safety.
passion for innovation,
His mentorship.
his commitment to giving back.
It's an incredible legacy.
It really is.
And I think the biggest takeaway
Yeah,
is that excellence is a journey.
not a destination.
It's about continuous learning.
Growing, pushing boundaries.
Using your skills to make a difference,
That resonates with everyone.
no matter what you do.
If you're striving to be your best,
Rohrich's story is a guide.
it's about hard work, dedication.
Commitment to improvement.
We can all make a difference,
Leave our own mark.
just like Rohrich has. That's it for our deep dive into Dr. Rod J. Rohrich.
Thanks for joining us.
We hope you enjoyed it.
Well, you heard it. What did you think of that? AI generated dialogue, the male and the female going back and forth. Basically, it was totally generated from script data and articles that I gave them, and talk about not only articles I've written, but also the history and the evolution of becoming a plastic surgeon and becoming an expert in rhinoplasty and facial rejuvenation. So was it useful? Was it helpful? Give me your comments. Send me a DM. And I know the future is going to be somewhat AI generated, but it'll always need the human touch. Give me your feedback. Until next time, enjoy.